Good day, everyone. Welcome to another episode of the Circle Direct podcast, the podcast that provides clear, concise, and valuable insights into essential health topics that affect our landscape today. I'm your host, Dr. Tiwa, and we are going to be discussing about tetanus vaccination and its serums. We're going to speak about the difference between tetanus toxoid and anti-tetanus treatments. Both are crucial in the fight against tetanus, of course, but they serve very different purposes. What we are going to do in this episode is to break it down as to what advantages each of them provide and when you should use each of them. Well, among healthcare professionals, it is generally accepted that diet and nutrition plays an important role in the management of diabetes, and it is necessary to supplement them with vitamins and mineral salts because they play a crucial role in managing these cases. Patients often struggle to maintain an adequate diet, especially when it comes to portion controls, weight loss programs, and stressful lifestyles. And additionally, these vitamins and mineral salts provide specific benefits to these patients. Alphabetic Plus is a supplement designed specifically for pre-diabetics and diabetics because it contains alpha-lipoic acid, which is a powerful antioxidant, and also contains 24 other essential minerals and vitamins. Research has shown that alpha-lipoic acid is the universal antioxidant, acting on both water and fat medium. It also helps to metabolize the breakdown of carbohydrates and acts on oxidizing species and free radicals. Additionally, it can recycle other antioxidants such as glutathione, coenzyme Q10, vitamin C, and vitamin E. It is not like every other multivitamin as it is uniquely designed for pre-diabetics and diabetics. It only contains vitamins and minerals needed by the patient's category at specific strength and proportion. Additionally, it does not contain copper or iron compounds, which pre-diabetics and diabetics should not take. It also benefits in preventing polyneuropathy. Things like numbness, burning sensation, paresthesia, tingling sensation, all these conditions that are associated with diabetes and end organ damage. So as I've stated before, alpha-lipoic acid is an antioxidant that works against free radicals and reactive oxygen species. It also serves as a universal antioxidant, helping with carbohydrate metabolism and improving glucose uptake by enhancing insulin sensitivity. Additionally, it recycles antioxidants such as vitamin C, vitamin E, coenzyme Q10, and glutathione, which ensures proper cell function. So Alphabetic Plus does not contain iron and copper, as research has shown that iron and copper are generally in high concentrations in diabetic patients as well as pre-diabetic patients, and they are major sources for radicals generation. Hence, one will be worsening the problem by this additional supplementation. Yes, Alphabetic Plus has cardioprotective benefits because it consists of two crucial ingredients, taurine and lycopene, shown by research to have cardioprotective benefits. Taurine, for instance, exerts anti-inflammatory benefits that improves diabetes and has shown cardioprotective benefits by acting on the renin-angiotensin system, while lycopene exerts cardioprotective function by lowering low-density lipoproteins associated inflammation as well as modulating high-density lipoprotein functionality towards anti-atherogenic effects. The anti-atherogenic effect is the process of forming plaques in the intimal layers of the arteries. It has anti-inflammatory and antiplatelet effects like blood clotting and impairs cholesterol synthesis. So with Alphabetic Plus, it has a lot of benefits that you should consider, especially as a pre-diabetic or a diabetic patient. And I hope that all these light that I've shared on all these benefits will inform your decision appropriately and will let you know that Alphabetic Plus is the best multivitamin to get out there. So before we move in to speaking about the vaccination or the anti-tetanus treatments, we have to first talk about what it is acting against. And this is tetanus. Tetanus is a very dangerous, severe bacterial infection caused by an organism called Clostridia tetani. This Clostridia tetani enters the body through cuts or wounds and then produces a toxin called tetanoplasmin, which causes muscle spasms and can lead to death if left untreated. That is where our anti-tetanus treatments as well as the tetanus toxoid come in to protect us from this particular event to occur. But how exactly are they meant to be used, or when exactly are we meant to use each and every one of these materials? So let's start with tetanus toxoid, which we would call here the preventative vaccine. The tetanus toxoid is a vaccination not only given alone, but in conjunction with other vaccines. If you look at the vaccination calendar, it's typically given with diphtheria, is a DTaP vaccine together in combination. And it is designed, that's the tetanus toxoid itself, against the effects of gram-positive bacillus, Clostridia tetani, which we have already discussed, causes muscle spasms in anyone it affects by producing the toxin tetanoplasmin. Now, when this vaccination is given, it helps to stop that action from occurring. But then how does it work? So typically with the way all vaccinations work, they work by activating the body's immune system. Most of the vaccinations given to the body are given as inactive antigens. So in this case, when a tetanus toxoid is administered, it has antigens that prompts the immune system to generate a response. This helps the body get in tune or get familiar with tetanus itself entering the body. So now this tetanus toxoid that is given is an inactive antigen. So it's a harmless version of what a tetanus bacteria is meant to cause. But because this tetanus toxoid has already been put in the body to activate the body system knows what is required and what is meant to do to fight the tetanus bacteria itself. Now, this process always includes multiple dosages so that they can elicit a high immune response. But there is no chance for this toxoid to exhibit any dangerous effects on your body because, like I said before, it's an inactive antigen. So when this inactive antigen is in the body, antibodies are then brought about by our fighting cells. These fighting cells include the B cells, the TH cells. They are activated and they produce immunoglobulins against this toxoid, allowing for adequate protection for subsequent exposure to the tetanus bacteria itself. Now, when and how is it meant to be given? The tetanus toxoid is usually given as a part of the diphtheria, tetanus, and pertussis vaccine in the vaccination calendar, which has a series in childhood. The vaccine itself is about 0.5 mils in dose and is given intramuscularly, but the area of where it is given, that is the preferred injection site, differs from year to year. Now, from infancy to around 2 years old, the anterolateral aspect of the thigh is the preferred injection site. But for children that are 3 years or older, the deltoid muscle is the preferred injection site. Now, this regimen is a 5-dose series starting at 2 months old and ending at 6 years. So your first dose now, you must be at least 6 weeks old, or your baby must be at least 6 weeks old when you give the first dose. The second dose, 4 months old. The third dose, 6 months old. The fourth dose, 15 months to 18 months old, must be at least 12 months old. And then there must also be a gap of 6 months between when you've given the third dose and when you're about to give the fourth dose. while the fifth and final dose is given to kids from 4 to 6 years old. The baby must be at least 4 years old and at least 6 months must have passed after the fourth dose. After you have done these 5 series of dosages, then you have to follow that with booster shots every 10 years, starting at the age of 11 to 12 years. What usually occurs most of the time, if parents have given their child the full 5 dose series, the booster shots do not come around because people are like, oh, I've gotten tetanus shot before, now why do I need to get more? But those booster shots just help your body get prepared to fight off tetanus, especially if you're exposed to bacteria down the line. Who needs the tetanus toxoid? Everyone. Tetanus toxoid is recommended to everyone of all genders and of all ages, starting from infancy, and then booster shots throughout life every 10 years. It is also vital for people that have higher risk injuries or are working in environments that have sharp tools or where wounds are very common. Now, of course, there are going to be contraindications to giving the tetanus toxoid, and the main contraindication most of the time when giving vaccinations especially is if the patient is suffering from an anaphylaxis reaction. When we say anaphylaxis, we mean an allergic reaction to the tetanus toxoid itself. Now, if the patient has an allergic reaction to this vaccination, you have to not give or you have to stop it. But this allergic reaction, of course, is treatable. Also, there are cases where a patient can have or a baby can have encephalopathy. That is when there is things that can cause brain dysfunction like confusion, memory loss, or coma. And they usually occur within 7 days of administration of the tetanus toxoid itself. If there is no other cause found for these symptoms, then you have to understand that don't give the tetanus toxoid to that child. So moving on to anti-tetanus treatments. Anti-tetanus treatments itself, this is what we have to give when we suspect or we see a potential exposure to tetanus. And they come in 2 primary forms. They come in either Tetanus Immune Globulin, that's a TIG, or a tetanus antitoxin. Now, we're going to concentrate more on the TIG, that's the Tetanus Immune Globulin. TIG is an injection of antibodies that provides immediate short-term protection against tetanus. It is used in cases when someone just maybe had a wound and we want to preempt if it is contaminated by Clostridium tetani. So the vaccination status of this person is either uncertain or incomplete. So if we juxtapose that when we are comparing it with tetanus toxoid, we have to look at it in this way. Tetanus toxoid is inactivated antigen. And when antigens usually enter the body, antibodies attack. But in the case of TIG, it is an antibody itself. So it provides extra protection with the antibodies that are already in your body. It gives extra protection with the antibodies that are in your body. And they are antibodies that are known to fight against tetanus itself. So they have more experience to come and fight a possible exposure of Clostridium tetani compared to your own antibodies that may not have even gotten the inactivated antigen of tetanus toxoid before. So that's why if your vaccination status is incomplete or uncertain, for that particular moment, a TIG is the best form to give because it is well versed in fighting tetanus. So if there's actually an infection of tetanus, those antibodies will help to fight it. The tetanus antiserum is administered in events of tetanus-prone wounds. When we say tetanus-prone wounds, we say wounds with fracture, deep penetrating wounds, bite wounds, wounds containing foreign bodies, wounds that are contaminated with dirt or soil, infected wounds, or if there's any extensive tissue damage, for instance, through burns or contusion, things like that. That is when we give the tetanus antiserum. Now, for child and adult, there's usually a dose of 1,500 international units as a single dose, or 3,000 international units if more than 24 hours has elapsed. Now, if it's administered immediately after injury alongside the tetanus vaccine, it is in a separate syringe and in separate syringe as well as separate injection site. So who needs the anti-tetanus treatment? Who needs it? Who needs TIG? Who needs the tetanus antiserum? Everyone, especially for individuals that are at risk of developing tetanus due to an injury that they had just recently suffered. And those individuals, either their vaccination status is unclear or they haven't been vaccinated at all. Those are the people that need these anti-tetanus treatments as soon as possible. Now, in the case where the TIG there's limited access to TIG, that's the Tetanus Immune Globulin, then we give tetanus antitoxin. Tetanus antitoxin itself is derived from animal serum, often horses. Horses are usually the source of this tetanus antitoxin, but the treatment is very less common due to the risk of allergic reactions, but it serves similar purpose to neutralizing the tetanus toxin. Now, to understand the difference between the tetanus toxoid and the tetanus immune globulin or the tetanus antiserum, it's already been stated from what I've been saying. The toxoid is a vaccine that provides long-term immunity to tetanus. It's an inactivated antigen that allows for the body to get familiar with the tetanus bacteria itself and knows what it requires to handle it effectively. Teaches your immune system to recognize the toxin and fight it before harmful events occur. That's what the tetanus toxoid does. While the anti-tetanus treatment, that is the tetanus immune globulin and the tetanus antitoxin, they are used for people that have been exposed to tetanus to provide immediate short-term protection. They are not a substitute for the vaccine at all, but they are crucial for emergencies. Oh, he has a fracture, they just suffered a fracture just now. Give him tetanus immune globulin, just for short, immediate protection against Clostridium tetani or the tetanus bacteria. That is the main difference between the tetanus toxoid and the tetanus treatments. One gives long-term immunity. Second one is for emergencies. One is an inactivated antigen. The second one is an antibody. This is more a simplified way to break down everything that's been said today. In conclusion, understanding the differences between this tetanus toxoid as well as the tetanus immune globulin is vital to staying protected against this harmful disease, because you don't want to be given a tetanus toxoid when you just suffered a fracture, because it will not provide immediate protection to tetanus. That is not the right vaccine. That is not the right step to take for short-term emergencies. For short-term emergencies, tetanus immune globulin, tetanus antitoxins, tetanus antiserums are the best bet to use. So recognizing the difference and recognizing when to use each of these things is very vital to understand and protect yourself from tetanus bacteria. Thank you for tuning to this episode of the Circle Direct podcast. I remain your host, Dr. Tewa. If you have any questions or if you have anything that you want to share with us, please leave your comments in the comment section below. We'll be very sure to go and check them out and answer any questions that you may have for us. We hope you have stayed informed and you know how to be proactive with your health regarding tetanus, and you know the differences between the vaccination and the anti-tetanus treatments. Thank you very much, and I'll see you next time.